So this is the Mucinex that I use before and then all throughout my ovulation and then for 3 days after my ovulation.
So that was Alexa from season 3, Love is Blind, the reality show. She recently revealed that she is pregnant, and she shared with her followers that she thinks she was able to conceive with the help of taking Mucinex for about 10 days around the time of ovulation. So obviously now social media is abuzz with everyone talking about their Mucinex babies. So what is Mucinex and why do people think that it can help your fertility? It comes down to the active ingredient that you're going to find in most over-the-counter cough syrups called guaifenesin. It works by thinning mucus and making it more filled with water, so it's easier when you're coughing to expel phlegm. So the idea or theory is that if it works on that, it could make your cervical fluid or mucus more liquidy as well, therefore potentially making it easier for sperm to travel through the reproductive tract. As a fertility doctor, it's always so strange to see these viral trends spread like wildfire when I know all well that this has been around, this theory, since the 1980s. In fact, it all comes down to a single published study from 1982 that was not well designed and was tiny. Don't believe me? Come along for the ride on my PubMed search. Okay, so searched guaifenesin and infertility and came up with 5 results. Okay, so here's a review article, number 1. Number 2, I didn't select because this is a single case report involving trying to improve sperm motility. And this is the one study from 1982. And so we're going to talk about that study. That's a single study and it's more like a case series because the numbers are so small. And these are just really review articles. And notice how it's all the same first author. So not a lot of robust evidence. At the end of the day, 15 out of 23 of the couples that had an improved postcoital test result got pregnant. Now, I want to point out there was no control group of patients who didn't take Mucinex to compare this group to. So this effectively is a very small case series. In my opinion, it proves nothing because we don't know if these couples would have conceived on their own without the help of Mucinex. Now, if you read the comments on these posts about Mucinex, everyone's like, oh my gosh, I have a Mucinex baby too. It worked for me. And what I tell patients is it probably doesn't work or help at all. And it's not something that I recommend people use month after month when they're trying because there's zero evidence to actually support this theory. There's a bias when someone's trying month after month that once they added something in here or there, whether it's a supplement or things like Mucinex that really have no proven ability to improve fertility, that's the thing that really did it, when really it's all about persistence paying off because every month there's anywhere from a 10 to 20% chance, depending on your age, that you're going to get pregnant. So it takes multiple tries to get your cumulative probability of success to an acceptable level. It's not benign to take a medication that you don't necessarily need 10 to 14 days each month, month after month. Taking Mucinex has side effects. It can cause dizziness, drowsiness, headache, nausea, vomiting, abdominal pain, just to name a few. But I think the real potential harm of these DIY, try it yourself at home type strategies with really no evidence of benefit is that it may delay you actually getting to the root of your problem, getting a diagnosis and getting proper treatment. And as we all know, fertility is time sensitive. So anything that could potentially waste your time is not a good thing in my books.